This is no longer isolated in just one part of our state. This is broadly shared as a burden and responsibility up and down the state.
So that was Governor Newsom all the way back on March 4th, 2020, declaring a state of emergency early on in the COVID-19 pandemic. The declaration freed up more resources to fight the virus. But now the governor says that that emergency declaration will end on February 28th. So what does this mean moving forward? It's a question that we've really been looking into since the governor's announcement yesterday. So during the nearly 3 years that California has been under a state of emergency orders, the governor was able to award almost $12 billion worth of no-bid emergency response contracts for things like testing facilities and mask manufacturers. Now, some of those payments were made to vendors who did not deliver the promised services to the state, and others that were federally investigated for fraud. The governor made nearly 600 pandemic-related executive orders during the last 3 years, the majority of which have already ended. Now, California is one of 10 states to still have its COVID-19 state of emergency status in place since March of 2020. So what could change after February when the order ends? Well, Governor Newsom, he plans to pursue 2 changes when the legislature returns, which are allowing nurses to be able to dispense COVID therapeutics and then also for lab workers to process COVID tests. Now, right now, California is averaging 3,000 new cases a day. That's not including all of those tests that people take at home, too. And restrictions have eased and vaccines are widely available. And some people feel that the pandemic has already come to an end. But we wanted to know, how do you feel? Has the pandemic ended for you? So Stephanie says that the pandemic is surely not over for me due to my weakened immune system. And I'm still having to take precautions and will continue to do so for probably the rest of my life. This pandemic has shown that people's attitudes toward public health and well-being is that of an individualist one. Another viewer told us, I am just starting to view it as a flu or a sinus infection anymore. No need to freak out and shut everything down again. But with that being said, people just need to learn to cover their mouths when they cough or sneeze and wash their hands. I do agree with the coughing and the sneezing, and make sure you wash your hands. That's very important there. All right, but Wanda says that I worked at a skilled nursing facility. It's not over yet. Of course, I want to hear your thoughts. I want to hear how you feel about the state of emergency coming to the end. Is the pandemic over for you? Shoot me an email. Let me know.